This is an area of planning that generates a ton of questions, and we're going to try to answer as many of those as we can. There are going to be three main things we want you to take away from this webinar. The first one is pretty straightforward. If you do not enroll in Medicare on time, you may be subject to a penalty. In addition to that, not enrolling in Medicare at the right time can cost you a lot of money. Additional premiums, out-of-pocket costs, and awkwardness in being able to enroll in other insurance. And finally, the third major point is that Medicare is just a piece of higher health insurance costs or health care costs that you will experience in retirement. And now is definitely the best time to be planning for that so that you don't run out of money before you run out of good, healthy life. As we go through covering those things and expanding on those things, we're going to divide our agenda to three parts. In the first part, we're going to talk about what is Medicare. We'll also talk about who needs to enroll in Medicare and when they need to do that in order to avoid those penalties and coverage gaps we talked about before. We'll also talk about the mechanics of actually completing the enrollment. In the second part of our presentation, we'll talk about how Medicare works, what it costs, what it covers, what it doesn't cover. We'll also spend time talking about the various types of private plans that are available that can be used in conjunction with Medicare in order to make sure that you have coverage that's best for your situation. In the third part of this presentation, we'll talk about some of the things that can impact those higher healthcare costs throughout the rest of your life. Two of the reasons are ones you've probably experienced a lot in your life already. Inflation, right? Stamps used to be 3 cents when a lot of you were born, and now they're almost 50 cents. Gas in the 1950 era was around 30 cents a gallon. Now it's 2, and we probably remember when it was 3 and 4. The other thing, and while many of you are aware of this, you may not have personally experienced it yet, healthcare usage goes up dramatically as we age. And so if you think about your parents or your grandparents, right, the last year, 2, 3, 5 years of their life was potentially very different medically than the first 50, 60, 70, 80 years of their life. And that's something that we want to make sure that we prepare for. We'll also want to make sure we dispel this notion that Medicare covers long-term care. It does not, and that requires separate planning. So let's get going, starting in that first part and talking about Medicare. Who pays for health care in the United States? Before you're 65, lots of different people will provide you your health insurance. Most people get it through their employer. If you've already retired, you may benefit from a retiree health plan. In between jobs, you may have had COBRA. If you're self-employed or in certain other situations, you may have individual health insurance. Many people are on public programs, especially with the expansion due to the Affordable Care Act, right? And so there's really a mishmash up until 65. But after age 65, Medicare really becomes the primary payer for almost every American. There's an exception for this, and we will go into greater detail on that exception later, but it relates primarily to groups that cover at least 20 people. And for pretty much everybody then, any other insurance you have is going to pay secondary. So failure to have Medicare will leave a massive gap in your coverage and is something to be avoided. What this means to you, and this is that exception, right, is unless you're covered by an employer that covers at least 20 or more employees, you need to enroll in Medicare right away when you turn 65. And I also like to emphasize that that's independent of your decision of when to enroll in Social Security. Medicare is for pretty much everybody 65. The other thing that is important to emphasize about this exception, and it will come up in other slides later, is that coverage through an employer must be based on your employment or your spouse's employment. Retiree plans, COBRA plans, severance benefits, these do not count with respect to Medicare. And if that's how you're getting your coverage, you would still be subject to late enrollment penalties and other complications that may prevent you from getting the coverage you need when you need it. So what are the kind of key consequences if you do not enroll in Medicare on time? Well, first of all, there's a late enrollment penalty. That's a large penalty, lasts for the rest of your life. In addition, healthcare costs may not be covered. Remember, we said that Medicare is primary and everything else is secondary. Well, if you don't have the primary coverage, you have a hole the size of Medicare in your health insurance coverage. And again, that is something to be avoided because of the amount that Medicare pays out on your behalf. In addition, most of the other plans that you would combine with original Medicare require enrollment in Medicare. And so you can't even buy those until you've enrolled in Medicare. So these are important things you want to keep in mind as you're determining when you're going to enroll in Medicare. What exactly is this Medicare that we've been talking about? Well, as you know, because you have parents, right, this is national health insurance for everybody over 65. There are some other people that it covers. We'll talk about that later. The plans are administered by the Centers for Medicare and Medicaid Services, CMS. You'll hear that acronym a lot, CMS. However, enrollment is handled through the Social Security Administration, and that can cause many people confusion and create a delay in enrollment if you're not aware of that. When it becomes time for you to enroll in Medicare, you'll need to coordinate that through the Social Security Administration. I mentioned that Medicare covers everybody over 65. It is key that you're a U.S. citizen, right? If you're not a U.S. citizen and you've been a legal resident for at least 5 years continuous, then you can buy into the system, right? So it's much more expensive to do it that way, but those people aren't left out entirely in the cold. In addition, some people under 65 are also eligible for Medicare based on their disability benefits or certain medical conditions. If you think this applies to you, reach out to Social Security or ourselves, and we can definitely answer those questions and walk you through that. Medicare itself was originally created in 1965 with just two parts. Medicare Part A, which is the hospitalization insurance, and Medicare Part B, which is the medical coverage. And full coverage at that time really meant having both, as well as some sort of retiree benefit. Retiree benefits were very common in those days. Unfortunately, they're not nearly as common today as they were then. Since then, Medicare has been expanded in a couple of different ways. In 1996, Medicare Part C was introduced. This was an attempted privatization, optional, of Medicare A and B, and it combined both of those as well as additional coverages to help round out and give people greater security. In 2006, Part D was added. Prior to this, there was no prescription drug coverage available through Medicare, and you either had no prescription drug coverage, you got it through an employer retiree plan, or limited benefits were offered through private plans that you may buy. Since Medicare Part D came out in 2006, Medicare Part C was modified to allow for comprehensive coverage that's both A, B, D, and additional coordinating or supplementing benefits. It's important to note here that while A and B are controlled and administered by the federal government, Part C and D are provided by private insurers that coordinate their coverage with Medicare based on contracts they have, and those contracts are subject to renewal and other features. In most of the country, there are two ways that you can get Medicare. You can have original Medicare, A and B, that we talked about a moment ago. You can add Part D, a prescription drug benefit, and a traditional Medicare supplement. This then results in comprehensive coverage, whether you're in the hospital, at the clinic, the pharmacy, and regardless of the size of your bills. Since 1996, there's been an additional option, Medicare Part C. This combines the benefits of Medicare Part A, B, and usually D together into a single package, a single card. And in many ways, this is like group insurance people have had before, where you're walking around with a single card, you use it no matter where you go. And that plan determines certain features of the benefits, deductibles, co-payments, co-insurance, etc. You probably live in Minnesota if you're listening to this webinar, and that means you have a third option. That third option is called a cost plan, and it's kind of like a hybrid between the two national standards. Now, under current legislation, those plans are only expected to last through the end of 2018. But for now, this third option allows you to have some of the best features of both at a price that's been very competitive for people. And we'll talk about that in more detail as we go through the three particular plans. How do you actually go about enrolling in Medicare and getting these benefits? Well, if you're already receiving Social Security when you turn 65, your enrollment in Medicare Part A and B will be automatic. There's nothing that you need to do. Of course, if you're still working, you can decline Part B if you don't want it. There are pros and cons to that. and making that decision often comes down to specific features of your plan at work, your budget, and what your plan is for retirement. Coverage with Medicare always begins on the first of the month, and in case of initial enrollment in Medicare with your 65th birthday, it'll start on the first day of that month. So if your birthday is the 25th of April, your Medicare would start April 1st. There is an exception to this, and that's if your birthday is the first day of the month. Then you get an entire extra month of Medicare coverage. So if your birthday was April 1st, you would get March 1st, and that's not an April Fool's joke. However, while getting into A and B can be automatic if you're already on Social Security, enrolling in Medicare's Part C and or D are not automatic, and you have to actively take steps to choose the private plan you want that best works with your situation. And that often requires planning. What if you are not receiving Social Security when you initially turn 65? Well, this is where the Social Security Administration comes in, because that's where you need to go to enroll in Medicare if you want it, because that's going to provide better health insurance coverage for you, or because you don't have health insurance coverage elsewhere. There are a few different times when you can enroll in Medicare via this process with the Social Security Administration. The first is during your initial enrollment period. This happens around your 65th birthday, and we'll talk about the specifics of that on the next slide. There's also special enrollment periods that are available to you. For instance, if you're working for an employer or your spouse is, and you're covered through that employer, you may want to delay Medicare. And if you do that, when you do later enroll in Medicare, you'll do it through a special enrollment period. There's also a general enrollment period. This is for people who somehow missed one of the other two. If you're enrolling during the general enrollment period, you're almost always subject to a penalty. So you do not want to use this method unless you absolutely have to. The other thing that's very tricky and problematic for people is if you enroll during the general enrollment period, which occurs from January 1st through March 31st, your coverage will not begin until July 1st. So if you discover in August that you need Medicare and you don't have it, you have to wait 5 months until January to enroll, and then it doesn't start till July. That can be a very painful thing for people. So you definitely want to focus on either getting into Medicare during your initial enrollment period or during that special enrollment period associating with the loss of coverage from your employer or your spouse's employer. If you are going to use that initial enrollment period and you're not being automatically enrolled by Medicare, you basically have a 7-month window where you can enroll in Medicare without any penalties. If you do it in the 3 months prior to your birthday, coverage will start on the first day of the month that you turn 65, just like we talked about a moment ago. If you enroll during the month of your birthday or the 3 subsequent months, this will delay your Medicare start, but there's still no penalty. So maybe mildly inconvenient, but not usually too serious. Obviously, if you've got health concerns, or you want to save money, right, you're going to want to get ahead of this and try to do it during the 3 months before so that you're not dealing with those headaches. Medicare Part A is enrolled in by just about everybody who turned 65. There's a couple of reasons for that. First of all, it's free. Second of all, the benefits are good. But there are some reasons that a person may not want to enroll in Medicare Part A when they turn 65. And this really comes down to those people who are on group plans, who probably have a high deductible health plan combined with a health savings account, and want to be able to continue making those contributions. Those pre-tax contributions to the health savings account can be very valuable. And you can continue to do that as long as you don't have any part of Medicare. But if you take any part of Medicare, including the free part to you, right, Part A, then those contributions will be disallowed. So that's definitely something you want to be aware of if you're planning to work past 65. What about Medicare Part B? Well, if you don't have insurance through an employer, you're not working, maybe you're self-employed or you're working at a small company with less than 20 employees. If you're on COBRA or receiving retiree health benefits, remember those don't count and would leave you subject to the penalty if you enrolled later, right? Or if your company's health insurance is less generous than Medicare, you want to take Medicare Part B right away. And for our experience, that's most people. It's certainly wonderful if you do choose to work past 65, and if your company provides you with great benefits, you may want to take advantage of that. But the vast majority of people find that Medicare is fantastic coverage, and an extraordinarily large number of doctors accept it, currently close to 99%, and the benefits are just very rich at a low premium. If you've enrolled in Medicare's Parts A and B, you almost certainly want Part D, and there are a couple of reasons for this. First of all, that's your prescription drug coverage. You've probably gone your whole life with prescription drug coverage, paid for it your whole life. Now, in this part of your life, why would you suddenly not want it? And there are a couple of other complications that I want to touch on very quickly here. The first one is, if you don't enroll in Part D right away during that initial enrollment period, you'll be subject to a penalty if you enroll late. That's annoying. It's usually not extraordinarily large, but it's usually cheaper over a lifetime to pay for those premiums in the first few months or years where you have little or no prescriptions in order to not pay the penalty for the long period of your life at the end. The other thing, and this can be more painful, is if you don't have that coverage and then you do have a change in your health and you do need a new prescription, there's no plan there to protect you from that. And as we've been hearing a lot on the news lately, prescription drugs are very expensive. They're the fastest growing, or the part of healthcare where costs are going up the fastest. And that leaves you with a major exposure, especially if you need one of these biologicals, one of these on-patent drugs, often called brand name drugs, right? And so it's definitely something that we recommend people have to avoid that nasty, nasty surprise down the road. Now, there are two different ways you can get Part D. You can get it with a standalone prescription drug plan, or through those Advantage plans we talked about earlier. You can also get it through the cost plans, which I mentioned briefly earlier. We'll go into how these particular plans work later in the presentation. If you're not using the initial enrollment period because you're still working for that large employer, or your spouse is still working for that large employer and you're delaying it, how do you use that, right? So again, special enrollment periods are for people who delay. They are on employer plans that include 20 or more employees. For Part B, you can basically enroll at any time. So it's very flexible until your coverage ends. Once your coverage ends, you have an 8-month window where you can add Part B and not be subject to a penalty. Part D is different though. While you can enroll at any time prior to the end of coverage, after your group coverage ends, you only have 63 days. And so for most people, because they want all their plans to coordinate, they're going to try to do everything within that 63-day window if they don't do it in advance. And most people, to be completely frank with you, are doing it in the 30 to 60 days prior to their retirement if they can see their retirement coming. That way they can have a seamless transition and no gaps in coverage. The best time to enroll here is one of two things: during your initial or your special enrollment period. If you miss both of these, you can still get coverage, but there will be a gap in coverage and there will be penalties. Try to stay away from that general enrollment period. The next couple slides cover the material I mentioned a moment ago about that general enrollment period. I just want to mention again briefly to remind you, January, February, and March is when you enroll, but coverage will not begin until July 1st. It does leave a large gap. As a quick review, during the initial enrollment period, anyone turning 65 can enroll in Medicare. If you're not working or your spouse is not working for an employer who offers coverage to more than 20 employees, you're going to want to sign up during those 3 months leading up to your 65th birthday. Coverage will begin then on the first day of your month. If you are working for one of those larger employers, you can choose to delay, use the special enrollment period later, and avoid the penalties and gaps in coverage. It's usually best, if you're going to use a special enrollment period, to sign up for coverage before your group coverage ends. You can often do that to coordinate the two so that you have no gap in coverage, but you also have no overlap. And this is important to minimize your premiums. Finally, if for some reason you miss both of these other two periods, you do have access to the general enrollment period. But as I said before, that leaves you subject to penalties as well as gaps in coverage. Most people who are not enrolled on Medicare automatically because they're already on Social Security will do so through the Social Security Administration website. The website's on the screen, www.ssa.gov. Under there, there's currently a link that says benefits, and then apply for Medicare online. And then you will eventually see an icon just like the one on your screen that says apply for Medicare benefits. If you're not super computer savvy, or you're trying to help your friend or neighbor do this who doesn't have a computer, you can also do phone calls, or you can even go directly down to your local Social Security office. But you do need to go through the Social Security Administration to complete that enrollment. Signing up for Part D does require some additional steps because it's not through the Social Security Administration and it's not automatic. Some homework will need to be done on how you want to get your Medicare. Do you want to do original Medicare, A, B, D, and presumably some sort of supplement or cost plan, or do you prefer the Advantage plans? And this will involve shopping, comparing plans, and trying to determine where you're going to get the most value, the most access, and maximizing the other priorities that you have. And that's certainly something that we have found can save people a lot of money and avoid a lot of grief later if that homework on the front side is done correctly. You can apply directly if that's your preference. After you've done your homework, reach directly out to whatever company you selected. You can also apply through Medicare.gov for these plans. You can call their 800 number, or you can work with a health insurance professional, someone like myself, to make that sort as well as to make the actual enrollment. And with that, we're going to move into the second portion of our presentation. And we're going to talk specifically about the different types of plans that there are, how they coordinate with Original Medicare, what Original Medicare covers, as well as what it does not cover. So let's start with a couple of high-level, big-picture thoughts. And the first one is the premiums that you pay only cover about 45% of all the costs of health care for the typical Medicare beneficiary. The other portion is paid for with various out-of-pocket costs, whether it's long-term care costs, medical provider costs, supplies, prescription drugs, dental, inpatient hospital, skilled nursing facility costs. There are a whole variety of these, and it's important that you understand that. You can, of course, choose other insurances to cover part or most of the services portion, but the base premiums don't do everything, only about 42%. So what sort of out-of-pocket costs do Medicare beneficiaries have? Well, first of all, there are Medicare Part B premiums. Medicare Part B isn't free. Currently, for new enrollees, costs about $121.80. For enrollees who have been on the program longer and were on Social Security at the time, they may be paying less. So if you talk to your parents or neighbors, you may run into people who are only paying $104.90. The prescription drug plans also have premiums. If you want a supplemental plan, like a Medigap plan or an Advantage plan, those will have premiums. And of course, just because you have a plan doesn't mean that it covers 100%, although such plans can be found. Many of the plans do still have deductibles. You may have copays when you see the doctor. And there are some services that are not covered by Medicare. So those sorts of things help make up the 42%, the $1,900 or the $2,000 a year. Medicare Part A is usually zero. That's what most people pay. The $226 and the $411 are for people who don't have enough quarters of work into the system and therefore are asked to pay part of that cost. The Part B premium you see on the screen is the held harmless, the $104.90. If you're a new enrollee, there's the $121.80. If you are a high income earner, first of all, congratulations on your hard work and effort, but there's additional premiums that you will be asked to pay, and those are on a next screen. Part D, those premiums will vary by plan and are kind of all over the map, from very low, $10, $15, $20 a month to over $100 a month. This screen outlines some of those income-related monthly adjustment amounts for high-income earners. On the left side of the screen, you'll see the modified adjusted gross income MAGI amounts, and these determine what category you're in. Below $85,000 for a single person or $170,000 for a married couple, you'd pay the standard amounts we showed you on the prior screen. As your incomes go up beyond that, you'll pay higher amounts. And as you read across, you can see both the standard Part B monthly premium paid to Medicare, you can see the Part B income adjustment, and you can also see the Part D adjustments because they also have income-related monthly adjustment amounts. This slide also includes an average. This is a national average Part D premium. You'll remember I said a little bit ago that premiums vary widely and can be significantly lower or significantly more expensive. And which plan you have will depend on the specifics of your situation, your prescriptions, and the amount of pharmacies you want to have access to. We mentioned deductibles a moment ago. If you had just original Medicare Part A, each time you're admitted to the hospital, you'd be responsible for a deductible of $1,288. And as I say, that's per occurrence or per spell of illness. And so you could incur that up to about 6 times a year. In addition, Part B has a deductible. This increases each year and is announced in the fall. For 2016, that's $166. After you've paid that, the plan is generally 80/20. That deductible is also waived for certain preventative services, which are typically covered at 100%. Part D may have a deductible, depends on the particular plan you choose. Can be as large as $360. For some plans, it's reduced or eliminated. Generally, that's associated with a higher and offsetting premium. If you were hospitalized and in the hospital for an extended period, your per-day charges beyond 60 days are $322 per day in the hospital. And if it goes over 90 days, those charges increase to $644 per day. That's a lot of money. Now, it's not common for people to be in the hospital that long, but this can run up bills of many thousands of dollars if not paired with appropriate supplemental advantage or cost plans. In addition, Medicare Part A leaves cost sharing for skilled nursing facilities stays in excess of 20 days. That's currently set at $161 a day. Please remember that this is not a substitute for long-term care, and this is really designed for rehabilitation after a hospitalization. The most common example that we see is in situations where people have joint replacements, a hip or a knee, and they're well enough to leave the hospital, but they're not well enough to go home, especially if their home involves stairs or other difficult to get over features. Medicare Part B, in addition to the deductible that we talked about a moment ago, is generally 80/20 coverage. Medicare will pay 80%, and you'll be responsible for the other 20%. However, doctors aren't required to accept Medicare, and those that don't accept something called assignment, and we refer to these as unassigned claims, can do something called balance billing. And this balance billing is an additional 15% on top of the approved charge. And so in a situation like this, you're really paying something closer to 35% of a bill, and it's a larger bill, right, than if the doctor accepted assignment. So those are things that you want to be aware of, and is, again, one of the primary motivating things for people to choose some sort of coordinating coverage to go with original Medicare. Part D, remember, has a deductible of $360. After that, the federal standard says that they have to cover 75% of the bill, which leaves you with 25% of the bill. Generally speaking, they do this with copays. And so, as an example, if you're on a Tier 1 prescription and your plan has $4 copays for Tier 1 prescriptions, you're going to pay $4. If the drug only costs $4, you're paying 100% of that drug's cost. On the other hand, if it's a $40 drug, you're only paying 10%. What's important for you to know is that there are a lot of different plans. Here in Minnesota, we have about 44 different plans you can choose from. And so their costs for the exact same drugs can vary widely, and comparing plans is very valuable. If your total drug costs get fairly large, roughly $3,000, you go into what's called the coverage gap, or as most people know it, the donut hole. Donut hole has not been popular. People have not liked that. And so we're currently in the process of phasing the donut hole out. In 2016, if you need a brand name drug and you're in the donut hole, instead of paying 100% of your drug cost, which is the way it was just a few years ago, you'll only pay 45% of that drug's cost. For generics, instead of 100%, you'll pay 58%. This is much better than paying 100%, but it's still significant cost sharing. And so if you are on expensive drugs, you should be prepared for this. And again, you'll definitely want to make sure you're comparing all the plans that are available to you to minimize your costs so that you're not surprised by those out-of-pocket costs. If your total drug costs reach a much higher level, which is around $7,000 in total drug costs or around $5,000 of costs on your part, you get into something called catastrophic coverage. And at this point, your costs are capped at 5% of the drug costs, $295 for generics, $740 for brand name drugs. And it's the greater of those numbers. So 5% is greater, you pay the 5%. If the copay is greater, you pay the copay. But that's the base plan. Again, Part D plans can be customized in lots of different ways, but they all have to be at least this good. And again, that's why we emphasize so much the importance of comparing all the different plans that are available in your area. Medicare then covers a lot of things. Covers hospital care, covers medical services, covers preventative services. But it does not cover long-term care, care delivered outside the U.S., dental care, vision, hearing aids, cosmetic surgery, acupuncture, many other types of alternative care, as well as those excess charges, the 15% above original Medicare, as well as the 20% that it would never cover and that you would always be responsible for. For this reason, many people want some sort of supplemental or coordinating coverage. This coverage can pay the deductibles, it can pay the co-payments for extended hospital stays, can pay the 20% of doctor bills that original Medicare doesn't pay, as well as those excess charges. Depending on the Part D plan you choose, you may have a waived or reduced deductible, you may have reduced co-payments, right? And all those benefits can give you a greater sense of security of not having your budget fluctuate wildly from month to month or year to year based on what's happened in your health. The first of those private plans that you can get to fill those gaps in original Medicare is a Medigap policy. These are offered from private health insurance companies. They supplement original Medicare and they follow federal and state laws that protect you and ultimately that standardize these plans. In most states, these plans are identified by letters. You, by your good fortune and choice, live in one of the 3 states that works differently. In addition to Minnesota, Wisconsin, and Massachusetts work like this. And the basic idea is you can get any plan from any company, and it will be identical to any other plan offering that same plan. But in Minnesota, it's a basic plan plus 4 riders, as opposed to the lettered plans available in other states. This is distinct from a Medicare Advantage plan, right? And you would need to combine it with separate prescription drug coverage. All these plans, naturally coming from private companies, have premiums that go with them. This slide, which I'm largely going to skip over because we are in Minnesota, explains the sorts of coverage that are available from the different lettered plans. You will notice that some letters are missing, and that's because these plans have since been retired by the federal government and are no longer offered, although beneficiaries who have them may keep them. In most of the country, the other kind of plan that's available are the Medicare Advantage plans. These plans all are approved by Medicare. They have contracts with Medicare. They're often called Medicare Part C plans. These private plans often work like group plans you've had in the past, where the company offering the plan establishes a network of doctors that you would want to see in order to receive the highest benefits. They establish deductible levels, co-payment levels, and out-of-pocket maxes. They generally combine and coordinate prescription drug coverage so you can get everything in one place. Some plans even add extras like vision, dental, hearing benefits, etc. When looking at plans like this, it's important to compare the benefits because they aren't standardized and identical the way they are with traditional Medicare plans. But for many people, the premiums on these plans are much lower than they are on the traditional Medicare supplements. And the coverage levels can be very high. And especially for people who are accustomed to other out-of-pocket costs from their group plans, plans like this may not come as a big difference other than the much lower premium. The cost plans, which are uniquely available in Minnesota and a couple other states, offer some features of both the Advantage plans and the traditional Medicare supplements. Like the Medicare Advantage plans, these plans have networks, deductibles, co-insurance, co-payments, and an out-of-pocket max. Unlike the Advantage plans, where when you enroll in the plan you're making a 1-year commitment, these plans remain flexible, and you can change your benefit levels from month to month. Many people really enjoy this feature because when they're healthy they can pay low premiums, and if they see or suspect their health is changing, they can change to another, more generous plan. These plans, however, are not expected to last forever, and you would want to have a conversation with an advisor or a professional to see if a plan like this is right for you. Due to their favorable premiums, they are still very popular. What drives higher health insurance costs in retirement? Well, there are a couple things, and we introduced them before, the inflation factor and the health factor. This initial slide, which is a lot of numbers, kind of gives you a sense of how healthcare costs break down in retirement based on premiums that are paid and the services that are received. You'll see that premiums don't vary very widely for the over 65 population. It's really the services that vary. And that's why it's so important that you start laying these plans early so that you're not surprised later in life, especially if your retirement plan is primarily built around fixed income sources that won't change meaningfully over the rest of your retirement. How do you build a budget for all of this? Well, you take each of the parts that we've talked about. Medicare Part B premiums for most new enrollees are $121.80. The typical national average policy for price for a Medigap plan, a Plan F, which is comprehensive coverage, covers everything 100%, is around $200 a month. And the national average Part D plan is around $40 a month. Altogether, this is about $361 a month in premium for extraordinary medical coverage at the hospital or the clinic and very good coverage for prescription drugs. If you multiply that out by 12, you'll see that that comes to over $4,000 a year. The average Medicare Part D drug beneficiary is spending roughly $800 over the course of the year on out-of-pocket costs. That may not be like your costs today, being young and healthy, but over the rest of your life you will see those changes. Or if you're on some more expensive drugs today, you may experience costs like that right away. Many Medicare beneficiaries that we work with also continue to take care of dental needs, vision needs, and have certain alternative costs that they may incur, acupuncture, certain forms of Eastern medicine, etc. When you add all those things together, for just one person, you can spend nearly $6,000 a year. Obviously, for a couple, that would be $12,000 a year. And if you start multiplying that out by many years, you can start to imagine how those numbers can get very large indeed, and why planning for this can be so very important. So lots of different things can cause these healthcare costs to change. What I just projected are what the costs are today. I didn't build in the inflation. I didn't really build in the changes to your health. These things can cause those initial numbers to become much higher, especially if you're attending this webinar and you're only 55, because you've got 10 years to go before you even get to those numbers, right? So I want you to be aware of those things. In addition, think about unique things to your situation. Do you have special needs when it comes to dental, vision, hearing, alternative care, or long-term care that may make your costs higher than the typical beneficiary that we've been describing? When you think about these costs over a lifetime, studies from different organizations like Fidelity, the EBRI, the Employee Benefit Research Institute, have come up with a variety of different numbers, but the numbers for couples are typically around $250,000 over the rest of your life from the time you turn 65. Now, you don't have to come up with all this money up front. That's the good news. The bad news is, for many of you, you will need to come up with that kind of money over the rest of your life, whether it's coming from fixed income sources or other sources that you're planning for. And that's where organizations like Summit can come in handy and do such valuable work for you, and why we have chosen to partner with them so that we know our clients don't have to worry about those things. Long-term care for many people is the most expensive portion of this, and because it's not covered by Medicare or by your Medigap plan, it requires separate planning. This planning is based around when you will need coverage based on your reduced ability to do what are called the activities of daily living. These affect very large portions of the population, and while I won't break it down for the different types or numbers or age groups, I do want you to at least see these slides to understand what significant proportions of people are impacted by the losses of various things: lung diseases, diabetes, vision and hearing impairments, heart and circulatory impairments, and arthritis, which is become the most common thing that prevents people from getting around, getting dressed, bathing, etc. Each of these things increase in their impact as you age, and again, you want to plan for that while you're young, while you're healthy, while you can get and do the planning. The planning that you do can provide any of a variety of different levels of care. For most people, the most desirable and cost-effective is in-home care. This sort of care could involve things like shopping, preparing food, housework and chores, and so on. This is often very comfortable, but sometimes care required grows beyond this level. And at that point, you may begin to need custodial care. This is when the care begins to impact those activities of daily life we mentioned before. These are each listed here. And remember that when 2 or more of these are impacted, that's when a typical long-term care policy would kick in and help pay those bills and reduce those costs. These custodial care benefits can still be received in-home. They can be received in an assisted living facility. They can be received in a skilled nursing facility. If you need to be exclusively in a skilled nursing facility, that is going to be your highest care option and where most people don't want to be. But this level of care can provide 24-hour supervision. It's often ordered or required by a physician in order to provide adequate disease management. In other situations, it's provided for rehabilitation. Often, again, we see this in situations around joint replacement. All of this care, though, does not come cheap. And if you have an elderly parent or relative who's experienced this, you've probably run into bills like this before. And you understand what that can do to budget and savings and how it can radically transform a person's plan. Again, that's why we encourage all of our clients to do planning and try to stay ahead of these things. There are a number of different planning strategies that can be done. Most of these involve trying to avoid having to spend down assets to go on Medicaid. This is an area where good planning, both with financial planners and with attorneys, can be essential. I want to encourage you, as you've taken the time out of your day to do this seminar, to take time out of your life to do these things. Because these things, especially if you've already experienced it with your parents or other loved ones, can be devastating on a person's lifestyle, on their finances, and on their plans, hopes, and dreams for their children and grandchildren. I want to leave you with just 3 reminders. Remember to enroll in Medicare on time. You do not want to deal with the penalties, the lack of coverage, or the coordination of benefits problems. Remember to shop carefully and compare plans when looking at private insurance. They're not all the same, although traditional Medicare supplements are standardized, and the benefits can vary widely. We are certainly available to assist you with that if that assistance is needed. Finally, don't forget to plan for higher healthcare costs in retirement. Retirement's coming, and it should be the best part of your life. Don't let this misstep ruin what could be and should be the best part of your life. I want to thank you for taking time. I know I've gone over a couple minutes, but you're certainly welcome to reach out to us if you do have additional questions.